We are almost at the end. Recalls, failure modes, and deficiencies of drug product, the nifty mini course was designed to help or facilitate your professional development. We are at the capstone. What is a capstone? To give assurance to others, we first must be self assured. To be self assured, we must be self authored in what we know and how we know it. In theory, the first principle in healthcare is first do no harm. In practice, that principle takes the form of care is research, knowledge is power, and wisdom is in practice. The three stages of drug development: pre-market, post-approval, post-regulatory approval, and real-world use of pharmaceuticals is founded upon quality of the development, effectiveness of the quality system, and patient outcomes, what patients experience in the real world. We have challenges of abuse, we have adherence issues, we have availability issues, we have affordability challenges, and assurance and authenticity of pharmaceuticals remains a gap that we need to fill continuously. We seek one quality voice within the sector. We have to listen to the voices of patients. The gaps between quality of development, effectiveness of quality system, and real world outcome, therapeutic outcomes, is something we want to be aware of, and we want to consistently work towards reducing and filling those gaps. This course is an opportunity to develop awareness of how to anticipate and prevent errors of omission. How you utilize this opportunity is completely up to you. So, as we come to an end to this mini course, how to personalize your course outcomes? As we discussed earlier, we come from very diverse education, training, and experience. We have graduate students, scientists in industry, regulators, senior executives. And the course outcome we were seeking is to bring awareness of how to anticipate and prevent failures, and do so at the early stage, the design stage of a product, the pre-formulation stage. And therefore, we focused on an aspect, solid state chemistry aspect of products that uh, un, often goes without the attention it deserves. I think that's really the key aspect of awareness we wanted to bring. Professional development is more than education and training that we achieve via formal education and training programs. This could be just simply be a formal education and training program, but it won't achieve the objective of facilitating your professional development. So, what do we do in addition to just going through listening to those lectures and thinking about the case examples that were presented to you by different faculty members? As I mentioned to you earlier, focused on methodology, focused on the process of solving a problem, and how to do that, I think becomes a key step that opens the door to professional development. So, what is a capstone? I think is the question I want to talk to you about. Um, Most of you should have completed 95% of the course is complete now, and a few things remain, capstone being one of those. So what is a capstone? Capstone is the culminating and usually integrative experience of an educational program. It could be a senior thesis, an opportunity for self-authorship. We're not defining a thesis for you, but having gone through this program, you should be able to, within your own context, define your self authorship goal. What do you want to author in your stage of career, in your environment, in your situation? I think is something I want you to think about. To help you do that, let me remind you of the importance of our opposable thumb. If you hold out your hand and look at your tips of your digits, fingers and your thumb is special. Thumb can connect, touch all fingers in a unique way. Without the thumb, we can't grasp things. The opposable thumb is one of the reasons for the evolutionary reason for the success of humanity. So think about the opposable thumb in the context of an opposable mind, which I will explain to you a bit more. But also think about a migratory bird's eye view. What we learn from that analogy is vision is not enough. A bird's eye, if a bird keeps its left eye focused very precisely on where its food is coming from, to pick out insects and grains from an environment where it's very hard to see them, but it keeps one eye on the big picture. But a migratory bird also has to migrate in uncertainty, in darkness. So it also has an internal magnetic compass. Professional development is migration to a different stage. So you need systematic focus, methodology, but you also need to understand the big picture. And you also need an internal magnetic compass to guide you through darkness or uncertainty. So, Opposable Mind is a useful book that I have read, which talks about integrative thinking. And I want to share some aspects of integrative thinking from this book as a way to help you think through your next steps. The problem solving power of integrative thinking. What is it? Here is a quote from Scott Fitzgerald, a American writer, author in the 1920s. The test of a first-rate intelligence is the ability to hold two opposing ideas in mind at the same time and still retain the ability to function. One should, for example, be able to see that things are hopeless, yet be determined to make them otherwise. That's what an opposable thinker does. So, opposable mind, analogous to opposable thumb, is an idea that Professor Roger Martin at University of Toronto has written about, and I like that, and I want to share what that is with you. If you can define the problem differently than everybody else in the industry, you can generate alternatives that others aren't thinking about. And the case examples we talked to you about, levothyroxine, phenytoin, are old examples. And we have not been thinking about these challenges, problems in ways that actually resolve and prevent the failures and recalls. So here is an opportunity, learning from these case examples, to think differently. Integrative thinkers embrace complexity, tolerate uncertainty, and manage tensions in searching for creative solutions to problems. And the process of integrative thinking starts with salience, looking at the big picture, collecting all the dots that may be relevant without being biased by our own constraints and our own thinking. So many of you may not have the disciplinary education in solid state chemistry. So for you, solid state chemistry is one element which is not necessarily within your thinking space. So adding that solid state chemistry as a dot in your thinking space and looking for causality what causes what. With levothyroxine, we saw the wonderful presentation by Professor Morris on establishing causality of the stability of that molecule. And then once you have the causality, you have to sequence, you have to prioritize your projects so that you can address each issue step by step. And then you seek a resolution to the challenge. And this is an iterative process. So the big picture is to be able to see the panoramic view and identify the relevant dots. Causality is the rigorous methodology to identify the mechanisms, failure modes. And then I think sequencing your problem to solve those rigorously and to find a resolution in uncertainty in darkness. So I think the bird's eye view, the opposable mind, opposable thumb are useful metaphors that we can use in our own professional development to support our professional development. As we come to an end and to say goodbye, let me bring this familiar slide back to emphasize that this course outcome was to really emphasize awareness, anticipation, and prevention mindsets. And to prevent recalls, product recalls, to prevent failures in quality, especially external quality failures, we have to focus on eliminating errors of omission. Omission, as an example here, was the solid state chemistry and the solid state attributes of performance attributes of dosage form, physical performance attributes of dosage forms. That was the key focus of this mini course. In this information age, information is freely available to us. We just have to let our fingers do the walking and search for information with keywords on internet. But knowledge is not information. And this cartoon illustrates the phrase, care is research, knowledge is power, but wisdom is in action. All are informed of the dangers of a leaking boat, but only two are acting, taking steps to do something about it. And if all of us took action to prevent product recalls and failures, we would really help improve satisfaction for ourselves and for the patients we serve. Taking action is as simple as letting your fingers do your walking, to acquire information and to understand that information in our context. Understanding information is to challenge our assumptions, our biases, our blind spots, to know the failure modes. And when you know the failure modes in your own context, information becomes knowledge, and it provides the power to take action. And that's really the message I want to leave with you. uh, Care is research, knowledge is power, and wisdom is in practice. So practice in integrative thinking. We did not assign a senior thesis or a project from a capstone project per se, but that's up to you to define what is your self-authorship project that you want to to take on and progress to facilitate your own professional development. And professional development is to go beyond education and training to be self-authored in what we know and how we know it. I think this is the key. How do you know what you know is equally important, and what you know is surely important. But how do you know what you know is important? And you cannot underestimate that value. So let your fingers do the walking. Convert the information that you received in the presentations and lectures and slides. Make that your knowledge, so that that's your power to develop yourself to be self-authored. So I hope you have enjoyed this mini course, and this is our small contribution to taking action on what we can do as National Institute for Pharmaceutical Technology and Education to help improve awareness, help people anticipate failure modes so that they can prevent quality failures that erode the assurance patients and their care providers need in the real world. In the real world, pharmaceuticals have to be better than placebo, not just in randomized controlled clinical trials where we just account for the placebo effects. By definition, pharmaceuticals are superior to placebo, and we can only guarantee that, we can only assure that when we prevent failures from occurring. Errors of omission are something that we have to eliminate by design. And that's what quality by design is all about. And I wish you the very best on my own behalf and the behalf of National Institute for Pharmaceutical Technology and Education. I hope this is a significant milestone for you. And so let your fingers do the walking and seek satisfaction in your own self authorship. Thank you. All the very best from us at NIPTY.